Hey there! If you're here looking for some clear, easy-to-understand information about a condition called anal stenosis, you're in exactly the right place. We're going to break down what it is, what causes it, and most importantly, what can be done about it. Our goal is to help you feel more informed and confident. So, let's get right into it.
First off, does this sound familiar? Maybe using the bathroom has turned into a real struggle, something that's become difficult or even painful. Or maybe you've noticed that your stools are getting thinner than they used to be. If you're nodding along, know that these can be key signs of what's going on.
So, what is anal stenosis? Well, in the simplest terms, it's when the anal canal, that final passageway out of your body, narrows and gets tight. Think of it like this. The tissue is normally soft and stretchy, but with stenosis, it gets replaced by stiff, scar-like tissue that just doesn't have that same flexibility.
And that loss of flexibility is exactly why you might be feeling those symptoms. Because the passageway has literally gotten tighter. It makes it much harder for stool to pass through. And that, unfortunately, is what can make it so difficult and painful.
Okay, that naturally leads to the big question. Why does this happen? What causes that flexible tissue to turn into stiff scar tissue in the first place? Let's take a look at the reasons.
So, what's the #1 cause? This might actually surprise you. A whopping 90% of all anal stenosis cases are a direct complication of a previous surgery, and most of the time, it's from hemorrhoid surgery, also known as a hemorrhoidectomy.
Now, while surgery is the main culprit, it isn't the only cause. There are other things that can lead to that scarring. We're talking about complications from other procedures in that area, or long-term issues like deep anal fissures. Conditions like Crohn's disease, damage from radiation therapy, or even just chronic inflammation from ongoing diarrhea can also be factors.
So if you're suspecting this might be what's going on with you, what can you expect when you go see your doctor? Let's walk through the diagnostic process. Knowing what's coming can help make that appointment feel a lot less stressful.
The evaluation is usually pretty straightforward. First, your doctor will just talk with you, ask about your symptoms, your history, and what you've been experiencing. Next comes a gentle physical exam to actually assess the narrowing. And sometimes, to get the best possible look without causing you any pain, the exam might be done while you're under anesthesia.
During that exam, your doctor will also figure out the severity of the stenosis. This is a really important step because it helps guide the treatment plan. It's usually classified as mild, moderate, or severe, all based on just how narrow that opening has become.
All right, once you have a diagnosis, the next step, and the most important one, is finding relief. So let's dive into the treatment options. And the good news here is that there are very effective ways to get you feeling better.
Generally, treatment for anal stenosis heads down one of two main paths. You've got non-surgical approaches, which are usually the first step for milder cases, and then you have surgical solutions, which are typically for more moderate to severe cases or for when the other treatments just aren't doing the trick.
Let's start with that non-surgical path. The main goal here is pretty simple. Make bowel movements as easy as possible. This means things like dietary changes to soften your stool, maybe using stool softeners, or adding fiber supplements, what some call bulking therapy. It can also involve a process of very gentle, careful stretching called dilation.
So the whole point of these non-surgical therapies is to get your stool to a consistency where it can act as a natural daily stretching tool. Every time you have a bowel movement, that soft stool provides a gentle stretch, which can help stop the stenosis from getting any worse, and in some cases can even help improve it.
Now, about that dilation we mentioned, this is where special tools, called dilators, are used to gently and gradually stretch the anal canal. It's often something you can do at home with guidance from your doctor, but, and this is so important, it has to be done carefully. Being too aggressive can actually cause more scarring and make the whole problem worse.
So what if the non-surgical stuff isn't giving you enough relief? Or what if the stenosis is pretty severe right from the get-go? Well, that's the point where surgery often becomes the most effective option on the table.
The whole goal of the surgery is really a two-step mission. First, the surgeon has to release the tight scar tissue to open up the canal. Then, they reconstruct the area by bringing in a piece of healthy, flexible tissue to replace the scarred part.
This kind of procedure is often called a flap surgery or an anoplasty. Think of it like this. Step 1, the surgeon cuts or removes the tight scar tissue. Step 2, they create a flap from healthy, stretchy skin nearby. And step 3, they move that healthy flap into place, which widens the canal and brings back that much-needed flexibility.
So after treatment, the journey isn't quite over. The focus shifts to healing up properly and making sure this problem doesn't come back. So let's talk about the road ahead, recovery and prevention.
Since we know that most cases are linked to hemorrhoid surgery, prevention really comes down to the surgical technique used in the first place. It is absolutely crucial for surgeons to leave what they call bridges of healthy tissue intact and to be very careful to minimize any heat or energy damage to the surrounding skin.
And for anyone who has a corrective surgery, what you do afterward is just as important as the surgery itself. Following your aftercare instructions to the letter is absolutely essential for a successful, long-term recovery.
This is why those follow-up appointments are not optional. They're critical. Your doctor needs to keep a close eye on your healing. They're looking for any potential issues, like making sure the new tissue has good blood supply or that the wound is healing shut properly. These check-ins are key to making sure you get the best possible outcome.
We really hope this has helped make the topic of anal stenosis a little clearer and maybe a bit less intimidating. If there's one thing to take away, it's that there are effective ways to find relief. So, are you ready to take that next step? Use this information to start a conversation with your doctor to figure out the very best plan for you.